اوكي
ان شاء الله.
جميل. بسم الله الرحمن الرحيم. الحمد لله رب العالمين وصلى الله وسلم وبارك على نبينا محمد وعلى آله وصحبه أجمعين. We welcome you all to the continuous medical education by the Oman Family Medicine Society, which is happening as usual with the collaboration with Dakhlya Priamry Healthcare Committee and Nizwa Healthy Lifestyle Project. Today is one of the topics which is highly required. A lot of questions are running in our day-to-day practice in the primary healthcare, and as a general practitioner or as a family physician or other like paramedics, which is the, I mean, a lot of question happens when an injury happens or like a suspected occupational asthma or dermatitis related to the workplace and other issues, how to manage, how to go for, and what's the system in Oman, and a lot of issues there. With us today is the Dr. Faisal Al-Badri. He is our colleague. He is an occupational medicine specialist at the Armed Forces Hospital, and he is also a senior officer in the, in the medical board in the Armed Forces Medical Services headquarters. He has done his training at the University of Cape Town in South Africa, and he's also a fellow of the College of Public Health Medicine of South Africa in occupational medicine. Today talk, as usual, it will take about 45 minutes, and you have the Q&As, so you can put your questions. We hope to answer it by the end, and of course there will be polls which is interactive. We'd like to, I'd like you to be active with us on these sessions, so we can get the feedback from your side. As usual, it is a CME accredited. You will get like 0.5 hours CME credits, and to get this one, I would like you to fill up the CME evaluation, which is pops up when you close your Zoom application. So please fill up the evaluation form, and you'll get like 1 day follow-up email for this issue. Please make sure that on your if you have put your name wrongly on the registration form, please put it right in an email to myself, so we can issue the certificate in a proper naming. So we'll give the floor and the ground to our colleague Dr. Faisal, and the floor is yours.
Thank you, Dr. Zahir. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everybody, and thank you for hosting me today as we celebrating the World Day for Safety and Health at Work. And it's a very valuable opportunity for me to talk about occupational medicine specialty and occupational health. And in fact, I'm not going to talk about any clinical occupational medicine, and I just want to raise the importance of this specialty, and I will define this specialty and the importance, and how can we, what's the role of family physician and general practitioners in this field. So my talk will be around occupational medicine cases. I will give some scenarios just to give you the taste of this specialty and the cases we see at our clinics. And then I will talk about epidemiology of occupational diseases and injuries. And then later I will define occupational medicine specialty, and I will define the scope of the specialty and the service we provide. And later on, I will talk about occupational medicine and occupational health status in Oman, and I will end up with the role of family physician in occupational health. So before talking about occupational medicine or giving a scenario of occupational cases, I would like you all to participate in this quick survey. So I'm going to launch poll, and it's only one question, and I'll give you 30 seconds to answer this question.
So the book speaks about occupational medicine, definition. So you can put which answer, applies to the question. Thank you. So we're getting different answers with a majority there. We'll wait for 60% response at least, or 70.
Okay, that's fine.
Inshallah. I think we'll go for we'll end it, if you don't mind, Doctor.
Yeah. Yes.
Okay. I'm doing the ending. I'm sharing the result now, Doctor. If you would like to comment on it, Doctor.
Okay, so occupational medicine specialty, I will talk about it later on, but this result surprises me because most of people don't know about this specialty, and people mix up between us and occupational therapy. So well done. 95% voted for the correct answer. And later on, I will talk about it in detail. Okay. So I will start the scenarios, and the first case, it's one of my published cases. It was around a scrub nurse that was complaining of facial skin lesions for 6 months and being treated and managed by our colleague in dermatology department. But his rash and his lesion resolved during holidays and annual leaves, but then exacerbate during work days. So what we did, we did what you call skin patch testing, where we take standard battery, which has got many known allergen, and then we put it on the back of the patient for 2 days, and then we read if there is any reaction. So he showed positive reaction to Carbamix and Yoxal K400. And then to make sure and to confirm our diagnosis, we took pieces of the mask and then we put it for another 2 days on the back of the patient, which showed very strong reaction. So this concludes the diagnosis of occupational contact dermatitis. Second case was diagnosed asthma, and she works in a spice factory where she exposed to spice dust. So what we did, we did the pulmonary function test, and it showed clearly significant obstruction with reversibility. So this is confirmed the diagnosis of asthma. Then we did the specific IgE to look for sensitization, and also this one confirmed the sensitization to spices, where the spices she was exposed to at the workplace. And then we did the serial peak flow, where we take measurement 4 times a day of peak flow for 4 weeks, and then analyze it with a software called OSIS. And I will show you the output of the OSIS. Software. Okay, so on the top part, you can see the diurnal variation towards the end of the day. And the score was 3.38, which is anything according to the manufacturer of this software, that anything above 2.5 is significant. So this is confirmed the diagnosis of occupational asthma, and we recommended to take her out of the section where she was working, and she completely became asymptomatic. This is a Carbaltonian Syndrome case, was diagnosed by hand surgeons, and they referred to the patient to us to confirm or to check work-relatedness. So we did we did ergonomic hazard survey. We used a tool called ART tool, which showed score of 31. And according to the one who designed this survey, or anything above 22 will be considered high risk or high ergonomic risk. And this is also confirmed the diagnosis of occupational Carbaltonian syndrome, and we recommended to take the patient out of the section he used to work at. This is a dentist I saw in my clinic at the Armed Forces Hospital. He was a dentist, and he claimed that he has a sensorineural hearing loss, and he claimed that this is because of the noise at his clinic. So what we did PTA audiometry, which showed sloping sensorineural hearing loss, and I highlighted the word sloping because it's not the classical presentation of noise-induced hearing loss. And then we did environmental survey where we measured the noise, and it was below the occupational exposure limit. So this is we rolled out work-related noise-induced or work-related hearing loss. Fifth case is a 25-year-old soldier underwent ACL laparoscopic reconstruction and was given by private hospital 6 months sick leaves. His commander wasn't happy about the sick leave, and he referred the case to us. And for me, it was excessive. According to international standards, it's only 6 weeks. And we give him, we ask him to resume his duty with night duties for another 6 months. This is my favorite case, and because it's this the part I enjoy in my specialty, because we work like intelligence people, like Sherlock Holmes or Conan, because we try to find the trigger. And believe me, it's really sometimes difficult to find the trigger of the disease. So this is a nursing sister presented with contact dermatitis for about 3 years, being managed by the dermatologist, but when she resumed her duty, the dermatitis exacerbate. So we did the first time we did the health risk assessment. We couldn't find anything striking, and then we did the standard battery, and nothing was suggestive. Then we did another skin or health risk assessment, and we found a trigger. We suspect that is the trigger. You notice that only on the tip of these 3 fingers. So we saw here holding this pin. So we took a piece of this rubber and we tested hair against this rubber using the skin patch testing, and that one, the finding was strong positive. Yeah. So we asked her to stop using this kind of pens, and everything went to normal, and she resolved. So these are some scenarios and some cases from my clinic, and just to give you the taste of cases we see between occupational diseases diagnosis and management, and fitness to work management. So we'll move to talk about epidemiology of occupational diseases and injuries. And before starting this, I would like you all to participate in the second survey. Would you do it please quickly?
We launched the second poll. Kindly, put your feedback on this one. And this will have like 2 questions on the poll. Take your time, but not so long. Okay, I think we reached almost like 65% of answered. Doctor,
Yeah,
shall we end the poll? Okay.
Yes, please.
Fine. So if you can comment quickly on the answers, then we can go forward.
Yeah, so most of you went to 600 and below in the first question. And the other question, as I expected, most of you voted for occupational accident. And I will talk about this also in details later on. So, according to global statistics, over 350,000 deaths are due to fatal accident, and almost 2 million deaths are due to fatal work-related diseases. As you notice now, it's fatality or morbidity or mortality due to occupational disease are much more than mortality due to occupational accident. So this gives an estimate about 6,400 people die from occupational accident or disease each day, and around 860,000 people are injured on the job. This number outnumber people killed in road accident, in wars, violence, and through AIDS. As I mentioned earlier, work-related diseases represent the main cause of death at work, killing almost 6 times more workers than occupational accident. And although respiratory, dermatology, and orthopedic conditions are more frequently related to occupation other than other disease, but any organ can be target of occupational hazard. And as you see here on the slide, 37% of back pain attributed to occupational risk factor, 16% of hearing loss, 13% of COPD, 11% of asthma, 10% of musculoskeletal injuries, 9% of lung cancer, 2% of leukemia, and almost 100% of pneumoconiosis and mesothelioma, and around 40% of hepatitis B and C in healthcare worker population. So despite this very high rates of occupational disease and injuries, we think that the real numbers are much more than those presented data, and the burden is definitely underestimated. And this because of many reasons. In brief, one of the most important is the long latency period between exposure and disease manifestations, especially in occupational malignancy and occupational connective tissue diseases. Also, the multifactorial etiology of most diseases or most occupational diseases, and like musculoskeletal disease, and the lack of recognition and diagnosis of occupational disease by physician. And this one has been proven by many studies. And underreporting of occupational disease due to the lack of proper or well-structured occupational diseases and injuries reporting system worldwide. So this huge number of cases consume about 4% of the world GDP, and in terms of absence from work, treatment, compensation, disability benefits, not to mention the human cost and the social cost. And this should highlight the need for a new paradigm of prevention, not only focusing on work-related injury, but also in work-related diseases. And as an example here, you can see that 3,000 billion euro being paid by the European Union due to occupational diseases and injuries, while they're investing around only 200 billion euro a year in preventing these cases. So occupational medicine specialty, as most of you answered right or correct, it's a medical specialty dealing with the assessment of workers' health, linking working condition and processes to workers' health, and of course, diagnosing and managing occupational diseases and injuries. So this specialty provides primary, secondary, and tertiary healthcare. So the services we provide as occupational medicine specialists, the clinical practice and three other services which collectively known as occupational health services. And this is, for me, this is the most important part because it's the part which prevent the occurrence of the diseases, and clinical practice is the part dealing with established or manifested disease and injuries and try to prevent disability. So as I mentioned earlier, so clinical practice, mainly occupational disease, injury diseases, diagnosis and management, also fitness to work, like doing pre-employment, pre-placement, return to work, and fitness for duty examination. And incapacity management through impairment and disability examination, and also holding or doing medical boards. The main part is preventive part of our responsibilities, and this through periodic evaluation through health risk assessment, and also after health risk assessment we design medical surveillance program to pick up early signs of cases, and so we monitor the health worker who are potentially exposed to hazard at work through medical surveillance program. Also, we do health promotion programs like smoking cessation, sedentary life intervention. Health and productivity management through managing difficult cases and chronic cases, and those who are utilizing chronic sick leave. And finally, we participate in health policy and planning to protect workers from developing occupational disease and injury related to the exposure at their workplaces. So in summary, this is the scope of occupational medicine. The first three parts is preventive part, and this is the clinical part, which is occupational medicine, diagnosing and managing occupational diseases, and incapacity management. And the first three parts work on this proactive measures to prevent the manifestation of the disease, and the clinical part to manage the established or manifested occupational disease and try to prevent progression to incapacity or disability. So in summary, we with the other health professional, we try to evaluate clinical presentations, and at the same time we evaluate occupational exposure to reach to or to verify if there is any correlation or association between the disease and workplace environment, and to rule in or to diagnose or to rule out occupational disease. In fitness to work part, we also evaluate clinical presentation with the help of other health professionals, and then we evaluate work requirements and if any impairment, and then try to reach to a decision on functional capacity of the applicant, and then to give a decision on fitness to work. So this is briefly about occupational medicine specialty and the scope of services it provides. Now we'll talk about occupational medicine and occupational health status in Oman, and my aim, my goal, talking about this part only to raise a question, not to answer. I will let you think and decide yourself about the status of occupational medicine, occupational health in Oman. So before starting, I would like you to participate in the last survey. Dr. Zahir, would you please pull it up?
Yeah, we'll do it now. Okay, the third survey will be long a bit, and you can take your time. There'll be 6 questions, and we'll also, touch it by then, inshallah. Please, let's launch now and take your time to answer the questions. Meanwhile, who are facing difficulty on to see the screen, if you are using your mobile phone, you can slide your mobile phone so you can see the slide itself. If the speaker, if the sound is not clear, if you're using like a phone, you can just put a speaker on the option of the audio. Thank you. Now we started getting the feedback of the colleagues. Myself, I'll take a long time to start answering. We are now near to 60% to reach of the votes. And I think we'll go ahead, Dr. Faisal.
Yes, please.
Okay. Now we can see your shared answer. You can comment quickly, Doctor, on the ones. Okay.
So despite the figures I presented earlier, so around 37 of occupational or back pain is due to occupational risk factor. Hearing loss, asthma, we still see that most of us see very low cases or very few cases of occupational disease, and this is against the international statistics. So I think we underestimate the burden of the disease, and GPs and family physician, they might miss many occupational disease cases. And second question, okay, the same, very that one less than the international statistics. Often do you take detailed occupational history? Sometimes, often. This is a good percentage, actually. 33 of you often, and 8% always. This is great. Okay, question: do you think that undergraduate curriculum in medical college in Oman provide knowledge and skills? No, 63%. This is what I feel also. And postgraduate study as well, 57 voted for no, which is also what I feel and I think. And last question: are you aware of any official reporting system for occupational disease in Oman? I'm not sure if anyone exists. I work for the Armed Forces Hospital and Armed Forces Medical Services, and we have our own system for reporting occupational disease and injuries. But when I was working for Ministry of Health, I wasn't aware of any occupational disease reporting system. Okay, so
okay, Dr. Faisal, can you exit the screen and then reshare again, because some people are facing some difficulty to see the screen.
Okay.
Like, I mean, stop sharing, then reshare again.
Okay.
I'll stop it for myself. Okay. Now you can reshare again, Doctor. Okay. Go ahead, Doctor.
Okay. So my answer for the last question, that I'm not aware of any occupational diseases reporting system, and this is also proved by this study, which is the only statistic or data I could find or during the last few days. And also I contacted our colleague at Ministry of Health, but this is the only published article around epidemiology of occupational disease in Oman. And there was no single occupational disease case reported in that article. And they themselves, they admit that there is no set mechanism on the collection of data on occupational diseases. And I was trying to find an explanation for this, and I proposed this model, and it has got two parts. On the left side, it's a very complex relationship between the three factors. And as you can see, that's and I think that underreporting, for example, underreporting of occupational disease lead to inadequate training in occupational health, because it doesn't create a need for training or specialized training in occupational health in Oman. At the same time, because we don't know the burden of the disease, the authority doesn't seem or predict or get a sense of the burden of disease, so they don't issue a good or solid legislation on occupational health and safety regulations. So this part lead to fragile occupational health surfaces, which also lead to high underestimated occupational disease rates. I think that training in Oman, training in occupational health is below the standard, and it's very crucial because the initial or patient with occupational disease and injury initially present to family physicians and GPs. So, and most of the even other specialists like pulmonologists and dermatologists, they don't, or they lack the training on occupational health. So we missed the opportunity to diagnose and intervene early to prevent complication of occupational disease. And this is proven by many studies, and you find it in literature. So one study, sorry. One study confirmed that occupational history is frequently ignored in clinical interviews, and other studies showed that 80% of occupational disease identified into occupational medicine clinic in the United States were not correctly diagnosed by primary physicians. So I will end up with the role of family physicians in occupational health. As I said before, this is very crucial, with very important role, because patients often seek service from, or health service or health care from GPs and family physicians. So treating patients who have occupation-mediated condition without recognizing the workplace hazard may delay recovery and increase the associated morbidity and functional limitation and overall cost of care. In contrast, early identification of occupational causes or contributor may not only reduce morbidity and mortality, but also prevent similar adverse health outcomes in the patient co-workers. Usually, occupational diseases work in clusters. So once you identified one patient, so it's a trigger to do incidence reporting and look for the reason or causes of this injury or disease and try to protect other workers. Also, you have a very important role in pre-employment examination, because as far as I know, public sector employer in Oman often ask family physician to examine prospective employees to certify job fitness and to detect health risks that may be exacerbated by occupational factors. And also, and finally, you have very important role in return to work examination, because family physicians are the ones who come in contact with patient or ill patient or the injured patient after utilizing their sick leaves from the specialized physician. So they usually try to extend their sick leaves by through primary healthcare visits. And please try to use sick leaves very wisely, because studies showed that early return to work, it has got very positive impact on the patient and his ability to resume his routine duties, and also in his mental and social well-being. So we have international standards, and try not to give any unnecessary sick leave for a patient who ask you to extend their sick leaves other than those prescribed by the specialist, the treating doctors. Because of the importance of occupational medicine and family medicine, the American Academy of Family Physicians incorporated occupational medicine skill and knowledge in their curriculum. And it's a very solid program, a very solid syllabus around occupational medicine. And I hope the same should be implemented in our country, in Oman, not only on the postgraduate studies, but also in undergraduate studies. We reached to the end of my presentation. I hope that it was useful for you, and I would be happy to answer your questions.
Thank you, Dr. Faisal, for your, more of like introductory talk to the and awareness about the occupational health. And we have some questions on the Q&As. And I think they're about the prevalences of some of the conditions. And like Dr. Sandeep has a few questions about the incidence of occupational benzene exposure cases in Oman, if you have any idea about it.
As I said, there is no single case that one occupational disease reported in the official reports. So honestly, I don't know about the incidence of occupational benzene exposures in Oman.
Okay. Of course, we have like in national, we have like injury report system, but we have it, but I'm not aware about it. It is like continuous.
No. Yeah. Occupational injuries, yes, they have a good system to report occupational injuries, but occupational disease, it lacks the well-structured system because first of all, we underdiagnose occupational medicine or occupational diseases, and also there is no defined reporting system to report occupational disease, and there is no compensation system in the public sector. There is a compensation system in the private sector, but in public sector, I'm not aware of any compensation system.
Yeah, we have like a committee usually in hospital. They decide like the level of injuries, and they go to the court, or we have like a decision how much the people be compensated. Like, so
it's a fragmented structure, and it's a fragmented system. There should be a uniform system which all through the country, and all healthcare workers, primary healthcare workers especially, and family physicians should be aware of this system and how to report it. And also should be a channel how to refer patient to confirm the diagnosis of occupational medicine cases.
Yeah, and that's another question about the army, because they're using like the, guns, etc. There'll be like a noise, etc. Do you have any like studies done about the history of sensorineural hearing loss in armed people?
There are international studies, but in our country it's classified. I cannot admit this.
Yeah, of course.
Sorry.
Yeah, but internationally, like what's the prevalence usually?
As I said before, it's around 14%.
Okay, fine. And okay, that's a question about how do you manage the loss of man days at your facilities, and how you manage productive loss either with chronic disease and acute illness injury, how all included in this management? If you can recall Dr. Sandeep Kumar question.
What is it? how you manage loss of mind is at your facility. So first of all, we have what we call admin medical board. So in Armed Forces Medical Services. So what we do, we try to push the patient early to his routine duties and stepwise approach. So we give him the moment we feel that he is able to resume his to join work with excuses, we try to push him to join the work, and also we give him a stepwise approach to till he reach full fitness to work, and we involve his commanders, his supervisors in this committee and in these decisions, and the doctor at the unit he also monitor his progress. And when we reach to a stage that we feel that we are comfortable to ask him to resume his duties, so we cancel all the excuses and we ask him directly to resume his routine duties.
Yeah, the question about the pandemic of COVID-19 and stress on the productivity of healthcare workers. There's one small study I think already published about the stress on the primary healthcare and the first-line COVID patients in Oman, but I couldn't recall the data. But it shows that they are higher in level of stress and anxiety. I don't know if you have any more studies, Dr. Faisal, highlighting this one.
Yeah, there are many international studies, and in fact, we don't need COVID-19 to highlight the stress at medical field. Healthcare workers around the world are exposed to very stressful environment, especially those working at A&E and ICUs and post-traumatic stress syndromes, those who are working in EMS. So, and with COVID-19, this statistic goes up, and very, very huge proportion of occupational health workers are exposed currently around the world to a very stressful environment. So we should intervene, and as we did here in Armed Medical Services, we use our colleague in psychiatry department, and there is psychotherapy, and we try to and there is one colleague who is on call 24/7 to try to help those who on need.
Okay, I think some people raise their hand. Can we take a verbal question, Doctor?
That's up to you. That's fine.
Okay, Dr. Sandeep, if you'd like to speak your question out, you have raised your hand. You can switch the microphone. Please start, Doctor.
Thanks, Dr. Zahir.
Yeah.
Very good evening. Assalamu alaikum to everyone. I pray everybody safe. I have just suggestion, a little bit, very speck of experience in occupational medicine, not experienced much. A suggestion in terms of man days and occupational medicine being utilized will be helpful. Like, suppose I just give a example so can audience and everyone can be in the same page what I'm trying to convey. Suppose we got let's say of a chronic diabetic patient unmanaged, he gets into amputation. There are two ways what I'd observed. Either the person who's working in whatever the field of whatever sector, he'll be made to go for leave, or we can utilize him as a useful workforce member. And there are a number of psychological factors going to play in that way. His family life, his productivity will fall, and obviously it will be burden to the institution where he's working. With the help of occupational specialist team members who are involved, they can find a suitable place along with the administrative staff, where even if he was active, let's say he's an active force member, he could be utilized at a place, let's say at reception, in a sitting job where he doesn't have to move or march in the field or stand in any active duty physically. So that way it will be much helpful in utilizing and reducing the man days loss, productivity loss, and loss to the organization in financial loss, as well as the family of that individual will not suffer due to man days loss and wages loss.
Great.
That was
Which is like, yeah.
So,
Yeah.
yeah,
Thank you,
can I
Dr. Sandeep. Yeah. Please.
The second one.
Okay. Go ahead and quickly, please, Doctor.
Yeah. Second was in terms of benzene. I specifically asked because it's a petroleum product generating country. I've seen people who are working for more than 20-30 years just transporting crude oil only and just checking the oil at the installation and with a dipstick and again at the delivery center. After 35 years, obviously it's known that renal carcinoma, leukemias, and dilated cardiomyopathy has been noted, which as a family physician or as a specialist, if you don't look into that, and we are missing these chronic diseases. Thank you.
Thanks a lot, Dr. Sandeep, for the very good comments, especially day-to-day practice on diabetic patient and also the benzene issue. Dr. Please.
I would like to thank Doctor for this for his valuable comments, and I totally agree with his first point that we need to push patient towards joining work as early as possible, because many studies show that work is very detrimental to physical, mental, and social well-being. In fact, the other studies found that those who been discharged because of medical board, they found that their health status declined very rapidly compared to those who continue to work. So I ask you all to try to push your patient towards resuming their work with, of course, with workplace accommodation. So we make sure that they won't get harmed by resuming their duties. Regarding benzene, I totally agree with you, Doctor. I'm aware of cluster of patients who've been exposed to pesticides, and all of them they developed peripheral neuropathies, and some of also other cluster of workers been exposed to X-ray, and all of them they developed infertility, and beside other developed cancer and another work environment. These patients, these cases are from our society, from Oman. I'm not talking about patients from other countries, but unfortunately, those patients discharged without confirming that this is an occupational disease, and they went home without compensation. So it's your duty as a GB and family physician, try to highlight or at least when you think that or suspect, first of all, you need to take very detailed occupational history, and when you suspect an occupational disease, please refer these patients to confirm the diagnosis for the sake of your patient.
Thank you, Doctor. And this is a message also, not only to report, also we need to modify and recommend modification of the field of the work environment, so to reduce also the exposure and the risk of the other workers. The other question, Doctor, about do you have a national protocol on occupational injury in Oman?
I'm as I said, I work for the Armed Forced Medical Service. I'm not aware of anything in the public sector.
So you can feedback also in the chat if anybody has information. What about the duty hours and scheduling? Do you have any guideline on this issue? And does it affect also as like it is one of the scope of the occupational health, the duty hours, the shifting duty, the curriculum, etc. on this one?
This is a very complex question because I don't know if you are aware, the few studies showed that shift work can, especially in females, is a risk factor to develop cancers. So, but we cannot stop shift work, and we cannot stop night work, so night shift. So this is really a complex question, and I'm not aware of any protocol regulate this or this part of work.
Yeah, there's like a comment from an anonymous colleague, and she's like expressing like some, doctors in primary healthcare, they try not to give a sick leave to avoid, instead of like to dig more, to look for the reason why people asking for a sick leave, because it might hinder like a background of occupational risk, occupational side effects, other issues. I would like to emphasize on this one.
Yeah, I said before, try to use it wisely, but we should not ignore their requests, and we should take a deep or detailed history and try to dig, as our colleague said, try to find why they are asking for to extend their sick leave. There might be a valid reason, and if you feel, but most from my experience, most people use maybe they have some social reason to extend their sick leave, like working so far from home, village or hometown, and others also because of difficulty to drive, and those are not a valid reason, not valid reasons to extend their sick leaves. But if you find any significant reason behind their request, you should consider it in your decision.
Great. And let's go quickly, Doctor. Quick answers, short answers. What is the percentage of occupational injury in Oman? Do you have any idea? Prevalence?
I'm not aware of this. I'm not aware.
Good.
But there is the study I showed. It has got very detailed statistic around occupational injuries in Oman.
Great. About if staff has any psychological stressors, where they should go? Do you have like any national call center for stress? We have like a national call center for public. So if they are stressed, they can call that number. Do you have like one call number for the medical team to call to get counseled about work-related stress?
I am not aware about public, but I'm aware some what the teams are found in some hospitals, like in our hospital, Armed Forced Hospital and Royal Hospital. I visited the Royal Hospital last week, and they told me that they have a team 24/7 available to support healthcare workers. But as a national team, I'm not aware of this.
Yeah. National, we have a phone number for a public, but MOH, I'm not sure. But I think people can utilize it and present themselves as a medical colleague.
Yeah.
Till we get this one, highlighted. Also about the, pre-employment examination. Do you have a criteria for fitness or unfitness in Oman? You know, that hepatitis B and short limb and other issues, HIV cases, and a lot of things get it raised up, and sometimes unethical. People, they may dismiss people from a work which they can do, or the vice versa.
Okay, so the ideal way is to first examine the job requirement, and then try to find if the candidate or the applicant, he can do job description or requirement regardless of whatever disease he has. So dismissing or rejecting hepatitis B is unethical, as you said, and I think we have protocol, but this is only applicable for Armed Forces Hospital, Medical Service, and Army. And because of the sensitive job we have, we always look for very healthy candidates. But I think for public job, they should not discriminate between patient, and especially hepatitis B. I found many people, even in our field, in medical field, they are always, in some application, like in some surgical specialty, they refuse them. And for me, this is wrong. There are many studies supporting this, and only those who will be involved in very invasive surgery should be spared from joining the specialty. But in minimal invasive surgery, they can do it. This is fine, and this is these regulations are found in UK, in Canada, and US, and we should follow their recommendation because they are more expert in this field than us.
Great. Dr. Ahmed Bousaid asked about, is there a committee for medical staff to look at their occupational injury in Oman?
I'm talking about armed medical services. Yes, we have, but I'm not aware of any system in MOH. And I tried to find this before I came, but I couldn't find an answer for my question. So I think maybe there is no such system exists.
What about your approach for a patient who comes with the post-COVID syndrome? They get myalgia, etc. on these issues. Do you have any protocol or approach in your institute?
For me, it's the same as managing other conditions. So we evaluate his functional capacity, and we try to find, first of all, what's his job requirement. If it's a sedentary job, he can resume his duty. If it's a demanding job, we first evaluate his functional capacity through pulmonary function tests, through X-rays, and we reach to a decision whether to ask him to resume his routine duties or to use a stepwise approach till he gain his full fitness.
Great. We're approaching 1 hour to reach, but quick questions. I mean, do you have already we have a comment on graveyard issues? I mean, our graveyard shift. If any idea about this issue?
Graveyard, yeah. I'm not aware of this. What
could be like a mnemonic? Could be like another definition for again a statement. And about, I mean, if there's like a guideline for fitness to decide for work, any a policy, we do see patient coming for fitness. Do you have a guideline or a policy? Some specialties, some type of work, they need a special fitness. People with scoliosis, they may need not to work in a certain position, or diabetic patient. I mean, to use a heavy truck trolleys and other issues. Do you have a guideline in Oman which is highlighting this issue?
No, in Oman, no, but in international, there are many guidelines for this, and for specific jobs. It's not a universal guidelines. For each job, they have their own guidelines. For truck driver, they have guidelines. For soldiers, they have guidelines. So this is specific for some certain jobs, like pilots, like divers.
Yeah.
It's not universal, yeah.
Yeah, fair. And what about, do you have a policy a patient cannot do a job, it will be transferred to another job? Do you have a written policy on this issue? Will be used? This could be there with the Ministry of Manpower or something. If you have any communication with them, do they have a policy on how to go with this issue?
In private sector, yes, they do. They have a committee, but in public sector, I'm not aware. But Ministry of Manpower, they have a committee for the private sector, and this is a right for a patient, his right to be accommodated, and if patient feels that he been discriminated, he should raise his case to court, and this is the way, because we don't have an occupational Health and Safety Act to implement implemented in public sector.
Yeah, we have the final question, Doctor. I mean, we do when I was going to Salah in a bus, we have two drivers changing one to the other. Do you have a policy on how many hours, etc., to driver to work, distance, type of car to be used, public transport, and other issues? And then we have Dr. Ahmed Bosaidi raise his hand. We'll get his voice question as a final question. Please go ahead, Doctor.
As I told you, there is no national guideline as far as I know, but I know that the national company, they have their own protocol. So, but it's not a national protocol. It's only a private protocol used by the company, and also by other companies in which work, these working in oil fields. They have their own protocols, but there is no national protocol exist.
Great. Dr. Ahmed, please, you can unmute your microphone if you would like to ask your final question. Ahmed Bosaidi, unless it is by mistake. Okay, I mean, some people, they put on the raise hand testing. I think by the end of this session, we'd like to get Dr. Faisal's final statement to the audiences.
Thank you again for hosting me tonight, this webinar, to just highlight the importance and the constraint of occupational health and occupational medicine in Oman. And I urge you all to try to gather more skills and knowledge in occupational medicine or occupational diseases, because your role is very crucial. Your role is more important than our role as occupational medicine specialist, because you, the patient seek you and seek your care initially. And if you fail to diagnose occupational diseases, the consequences and complication of this patient wouldn't be possible to prevent.
Thank you, Doctor, for the nice presentation, and we'd like to thank the audiences for the time spent with you. As a reminder, when you close your Zoom, you'll get a pop-up message and link. Please fill up the evaluation form. Otherwise, you can get a reminder for after 1 day to get your to get the feedback on our CME today. Inshallah, after 1 day, we'll send you by email your certificate with your attendance certificate with the credit hours. If you want to see the previous CMEs,
Doctor, there is one comment I would like to raise. Please, okay. As a physician and general practitioner, I would like you all, I would urge you all to be an advocate for that one increase the awareness of the importance of occupational health training in undergraduate and postgraduate medical studies. This is very crucial if we want to develop our occupational health systems, occupational health services. The first part to tackle is to have very qualified doctors who can diagnose and manage occupational diseases at primary healthcare institutes.
Yeah. Thank you. As to put it on the curriculum of training of the different specialties. Thank you, Doctor, and see you, inshallah, in the coming sessions. For the previous sessions, you can access our YouTube channel, Oman Family Medicine Society YouTube. You can get the previous sessions there. Thanking you, and enjoy the rest of 15 days of Ramadan. And we hope we can meet earlier in other CMEs, and have a nice night, and goodbye to all. Assalamu alaikum wa rahmatullahi wa barakatuh. See you more in the coming sessions, inshallah. Assalamu alaikum. Ma salam.